Hi, I'm Joe Moran. I'm the Bariatric Surgery Program Medical Director here at Clinch Valley Medical Center. Most people that come to see us in the office today have several underlying comorbidities, including diabetes mellitus, hypertension, obstructive sleep apnea, elevated cholesterol. As long as an individual meets the guidelines from the National Institutes of Health, which stipulates that an individual with a BMI more than 40 or a BMI of more than 35 with certain comorbidities would qualify for surgery. The purpose of the surgery is to help individuals lose weight and resolve or improve their comorbidities, improve their quality of life, and prolong their life expectancy. We do recommend that people meet with our dietitian prior to surgery, and they go over all of the preoperative dietary instruction, education for the patient, and advocate for the patient losing weight prior to surgery. It focuses on the basic tenets of proper nutrition, including appropriate protein intake every day, how many grams of carbohydrates every day, how much nutrition you should be intaking every day. The two most common procedures done currently are the Roux-en-y Gastric Bypass and the sleeve gastrectomy. The Roux-en-y Gastric Bypass is the gold standard. That's the operation that's been around for the last 40 years. And the sleeve gastrectomy is actually the most commonly performed procedure today in the United States. Two procedures are done in the operating room with general anesthesia. They typically take anywhere between 60 minutes for a sleeve to 75 to 90 minutes for a bypass. The bypass is a restrictive and hormonally active metabolic procedure, a malabsorptive procedure, whereas the sleeve is a restrictive and metabolically active procedure. They help to limit the amount of food that an individual can eat per meal, but also help to decrease the amount of hunger that a patient is experiencing between meals. The best surgery for them is the procedure that they're going to embrace and educate themselves about and feel comfortable with. And people make their decisions for surgery based upon the research and the education they've done, and by talking to other patients who have had surgeries and so forth. Yeah, we always recommend that patients come to at least one support group meeting prior to surgery. I think it's a great venue for people to discuss their feelings and what they may be thinking about, and to find out a little bit more about the procedures and the preoperative and as well as the postoperative process. Any education they can get or information from other patients about their experiences is just going to be beneficial in the end. The preoperative protocol is, for our practice at least, is that all patients have to meet with a clinical psychologist before surgery as well as a licensed dietitian, and that's required by all insurance companies as well. And then the additional workup may include possibly a cardiac evaluation or gastroenterology or pulmonary, depending upon what other comorbidities the patient may have. The surgeries typically last anywhere between 60 to 90 minutes. They're done laparoscopically with a couple of small little tiny incisions. After the surgery, patients are taken to the recovery room where they spend about an hour to 2 hours in recovery, and then they go up to the surgical floor. In rare instances, do patients go to the intensive care unit. Most patients will spend one night in the hospital, sometimes two. They're started on liquids, followed within a couple of hours of completing the surgery, and then the dietitian will see them while they're in the hospital prior to them going home as well. The patient will be given detailed instructions about activity and diet, as well as what medications to continue or not continue prior to going home. After discharge from the hospital, most people are out of work for a couple days, usually until they come back to see me in the office. The typical length of time that people are off from work is maybe a week, and then they're able to go back to work. If you have a job that requires heavy lifting and you cannot go back until you're 100% able to perform your duties, then you may be out a little bit longer, but most people go back to work within a week. Most people lose on average between 50 to 75% of their excess body weight, and that happens typically over an 18 to 20 month period of time after surgery. Post-operatively, patients can expect to see me at every visit in the office. I typically see my patients a week after surgery, and then at 1 month, 3 months, 6 months, a year, 18 months, 2 years, and then annually thereafter. Patients are or can see the dietitian post-operatively at any time, as well as the mental health provider and any of the other specialists that are on our staff. Pain, there will be some pain, discomfort after surgery. Again, this is all done laparoscopically with a few tiny little incisions. So the benefits of laparoscopic procedures are less pain for the patient, less chance of infection, less chance of developing a post-operative hernia, a quicker return to a normal preoperative level of functioning. So those are all beneficial for the patient. Well, if patients are contemplating weight loss surgery, we do recommend that they contact our office, provide us with some of their information, including name, date of birth, what insurance they have. We also recommend that they call their insurance carrier to find out specifically what's covered, what's not covered within their insurance. My office will do the same as well. Today in the United States, the vast majority of insurance companies, including Medicare, do approve bariatric surgery. But it is certainly policy specific, and policies can differ within companies and within states. I hope this educational video was helpful today. If you have any questions, you can call our office at Clinch Valley Surgical Center at 276-596-6765. You can look forward to us providing additional information on our website, including information on patient seminars and support group meetings.